I think we've had some very productive discussions about how the disease is impacting the Iranian community. We've shared a lot of lessons that we've learnt from elsewhere, and our Iranian colleagues have shared with us a lot of the lessons they've learnt from managing the disease here. I think that the campaign that the government is launching over the next couple of days is really based on a lot of the lessons that we've all learned, and I think that the priorities are appropriate, and I think if implemented at the scale required, we'll have a very good opportunity to get on top of the disease. I think we have to remember that the outbreak started in Iran only 16 days ago, and I think there's been impressive progress in many areas since then. Over the last few days, we've visited a hospital and a clinic. As the Deputy Minister said, the medical staff, the nursing staff are very hard-working, very dedicated, and I think the quality of care that we saw in those facilities was good. I think you've made very good progress on testing for the disease. Already in Iran, there are 22 laboratories across the country that can diagnose the disease, and soon that'll be 41. That's very impressive progress in a relatively short period of time. In terms of restrictions on travel to and from Iran, WHO does not recommend any travel restrictions in response to the coronavirus outbreak, as no travel restrictions to Iran or to any other country. Some countries and some travel companies, such as airline companies, have decided for their own reasons to institute those restrictions. We always recommend from WHO that those types of decisions be based on evidence and a good public health rationale. And when countries do make those decisions, they're obliged to report to WHO so we can discuss the public health rationale with them and try and make those suspensions of travel as short-term as possible.